Hello, my name is Melva Mitchell. Today I will be presenting my teaching and learning strategy reflection. The setting is post-conference and my reference group is 2 nursing students. They will be sharing their clinical experience as they rotate through an ambulatory clinic. My students are Brittany Petrie and Tara Pitts. Hello Brittany, how was your clinical day?
My preceptor and I worked at Station E. Our assignment is to check in patients to see their primary care provider. My patient was a 56-year-old male with diabetes. He was doing a 3-month follow-up. His blood sugar were controlled as my preceptor reviewed the logs. She could see he was checking it daily and he was taking his medication as prescribed. My preceptor then asked him if he had any questions regarding his diabetes and what he was taught on the last visit. He said no. I have been using the journal we put together. My patient was pretty simple.
How did your patient use his journal?
From the journal my preceptor put together for him, he could look at the numbers written down and compare it to the blood sugar he got when he took his blood sugar.
Good job. Okay, thank you. Tara, how was your day?
Today, me and my preceptor was working in the nurse assessment area and a patient came in with chest pain. The patient was a 30-year-old black male with high blood pressure and no history of heart disease for him or his family. He stated the chest pain started last night after he ate dinner. My preceptor then had a PCT come in and started 12-lead EKG and did a pulse ox. My preceptor also applied oxygen. During this time, vital signs were being done. The vital signs was 160/110, the heart rate was 120, respiration was 20, the temperature was 98.2, and O2 set was 93. But the amazing part was when she started asking questions. She knew exactly what to ask him. She asked questions like, are you dizzy or had blurred vision? The patient stated no. What were you doing when the pain started? The patient stated he had just finished having dinner.
Tara, let me interrupt you. As a novice nurse, what would your nursing diagnosis be right now?
Asked him, he had indigestion.
Most nurses would assume that because of the way he said after he finished eating and the chest pain. Continue on. What did your preceptor continue with?
She asked what are the relieving factors? The patient stated nothing. Is the pain sharp or stabbing? The patient stated it is sharp. On a scale of 1 to 10, with 1 being a little pain and 10 being the worst, what's your number? The patient stated 10. Are you having trouble breathing? The patient stated a little. Does deep breathing or movement make it worse or better? The patient stated deep breathing makes it worse, but movement is okay. She also asked, does the pain radiate down his arm, and if so, which one? The patient stated he is not having this problem.
What was the final outcome?
She then made an appointment for the patient to see his doctor. The chief complaint was high blood pressure and medication refills.
Both your preceptors have many years of experience. As novice nurses, this is something you will not gain until you have a little time, because reflecting is remembering an experience and learning from it to make the next encounter better. Your preceptors asked the patients both open-ended questions, and that's how they were able to gather the information needed. I have a question for both of you ladies. If you guys were to experience this again, do you feel you would be able to deal with the situation the way your preceptors have? Tara?
Yes, because I have written it in my reflective journal, and as I transition into my professional role, I can look back on how my preceptor used open-ended questions and her knowledge of a patient with chest pains to make her assessment.
Brittany?
Yes, because I will have written it in my journal and I will ask my preceptor for a copy of my patient journal for a reference if I encounter another diabetes patient. I will have my journal for a reference if I need it.
Next week's assignment is for you ladies to complete your reflective journal. This is for your final grade. I feel if both of you ladies continue the reflective journal in your practice, it will increase your knowledge. But just make sure that as you use the reflective journal in your practice, you keep it with the current theory and with your organization's policies. Is there any questions?
No.
Thank you for presenting your clinical experiences with me today.